recognize today that actually more is also more. His family has been a huge part of this, not just Lydia and Herbert, but the extended Moore family, and I know you're all hard at work in front of the scenes and behind the scenes. I also just wanted to start with take a moment to why we're all here today. If I'm not mistaken, quite a few of us, including myself, it's not plan A for us personally to have more children. We're here because we care about the other people in our community. We care about our neighbors, our friends, the people who live here now, and the people we want to move here in the future. And we know that to have a community that is healthy and robust, we need to have a community hospital that offers full spectrum of services to its residents. So I first thank you all for showing up today, and for, by the way, the full spectrum of all of us showing up here. It's important that we are all on the same page here. We have the same desire. I wanted to also focus on the fact that this is a rural healthcare. If you read the news, we all know that rural healthcare can be complicated and expensive if it's done well. And many of us who have been involved in any number of nonprofits in the community that have been involved in both social and health services over the years have been working on this issue for decades. There are many of you, I can see many of you in this audience. I have been on the Board of Women's Support Services, which periodically gets asked, why don't you merge with a bigger agency? Because it'd be cheaper to provide the services out of another bigger town. We don't do it because we don't want, we've heard many people account today, we don't want a victim to have to wait an hour to see a counselor. We don't want them to have to drive 5 minutes to get to the hospital or to get to a counseling session. It matters to be able to provide these services right here in our rural communities. And I just want to note that we have a lot of resources in this community, in part because many of us have been engaged in this fight for so many years. We have a number of nonprofits who've been working on this issue. We also, let's talk about the Sharon Hospital Board itself, which includes a number of people who have significant healthcare experience and the capacity to help craft solutions going forward. So I want to focus, another resource that we do have available to us is the state. There's a reason why the state has oversight in a number of ways here, and that's because healthcare is a public good. One of those areas of oversight is with respect to charitable funds. The Attorney General's office always has jurisdiction over charitable funds, and because there were charitable funds invested in this hospital, they have jurisdiction to make sure that those charitable funds remain spent, both the ones that have been invested already and the ones that are committed in the future, for charitable purposes, for the specific charitable purposes for which they were intended. So that's one insight. And those conversations are already going on between the AG's office and these local nonprofits. So that's good. And that's partially started because of all of us. A second one that has also been alluded to before is the basic, because healthcare is important to all of us, changes in healthcare services have to be approved by the state. And in this case, we have a number of, when the original merger took place, as Brian went through a few minutes ago, the Health Quest made various promises to the community. There's a certificate of need on file. It's 1,700 pages long. But they made certain commitments. Those need to be looked at. There's also, if Health Quest intends to formally shut down the maternity ward, they have to file notice of that. They have to file a certificate of need. We can, through signing these letters and petitions that are out there on those tables, we can make sure that the Office of Health Strategy compels hearings. Because one of the things that's happened over the last few weeks that has been really destabilizing is the chaotic release of information. It's no way to provide health care and reassure the residents of our community. So if we can all band together and make sure that hearings are held on that request to close the maternity ward, we can make sure that our questions get answered. And I'm going to suggest that in addition to signing all of the petitions that Herbert and Lydia have been talking about, that we all start to form a list of what those questions are, what we want HealthQuest to provide information on, what we perhaps need to do some research ourselves. And so I just spoke to Herbert earlier. I think maybe the best way for us to do that is if you have a question that you think HealthQuest ought to answer, you should perhaps email savesharonhospital@gmail.com. How about that? I think that would be a great way for us to collect the information that we need to make sure we get in order to put together not just a short-term solution which can prop the maternity ward open in the short run, but a longer-term solution that may very well involve all of us, all of our organizations, all of our nonprofits, all of our personal expertise, and the state's insistence. So thank you all for being here today, and for the organizers for all your incredible work, and let's do this together.